Hi everyone, my name is Nithya and welcome to my presentation on cardiovascular disease misdiagnosis in women's healthcare. So a little bit about me. I live in Acton, Massachusetts. I will be a senior at Acton-Boxborough Regional High School next year. And I have done research on gender bias in healthcare for HOSA last year. So the student speaker series gives me an opportunity to delve deeper into this topic and focus on a more specific issue. And for other extracurricular activities, I am a board member, I play tennis, I'm an ambassador, and I'm involved in a couple of clubs. And in the future, I'm interested in becoming a pediatrician. So some questions you might have are, what is misdiagnosis? Why specifically cardiovascular disease, and how is this a global health issue? Well, misdiagnosis refers to cases where a patient receives an incorrect, delayed, or no diagnosis, and these events can lead to further harm in the patient if the problem isn't identified quickly enough or not at all. And I chose to hone in on cardiovascular disease because it is the leading cause of death for women globally. And this is a global health issue because gender equity and proper diagnosis must be achieved. According to the Lancet Commission on Women and Cardiovascular Disease, some of the world's most populous nations, all of which are in Asia, have seen an increase in CVD, including China, Indonesia, and India. Further, the highest CVD mortality rates have been recorded in Central Asia, Eastern Europe, North Africa, and the Middle East, Oceania, and Central Sub-Saharan Africa. Even though cardiovascular disease is the leading cause of death for women globally, many people do not realize how misdiagnosis exacerbates that death rate. This graphic is also from the Lancet, and it highlights how 35% of all deaths in women worldwide are caused by CVD. Meanwhile, more research and treatment is needed among women with CVD. There are certain gaps hindering proper diagnosis, and those are the knowledge gap, the trust gap, and the aid gap. The knowledge gap refers to the lack of clinical representation of women in research and the lack of knowledge of sex-specific symptoms. Until a couple of decades ago, clinical research only included men, of which those results were often generalized. In this graph, we can see how there was a steady increase of the amount of women included in clinical research, but after the pandemic, it's hit an all-time low. Furthermore, in the US, there is a disparity in the number of women included in clinical research, even though they are the most affected. And these quotes from the World Heart Federation and the European Society of Cardiology emphasize how not only are physicians unable to recognize symptoms of cardiovascular disease in women, but so are women themselves. In Table 1, we can see how there are various symptoms apparent in women, but not men, which are usually unknown and lead women to be diagnosed with something else. In other cases, some women do not realize that they are experiencing symptoms of CVD and prolong making an appointment, which increases their risk of death. But when they go for an evaluation, most women experience the trust gap. The trust gap refers to stereotypes and misogyny in healthcare, which leads to a lack of belief and attention when evaluating women. When women are vocal about their pain, their complaints are often considered an overreaction instead of something to be serious about. They are often dismissed on the premise that they might be hormonal or maybe experiencing anxiety and stress. Also, as a result of pre-existing beliefs, women tend to be less satisfied than men with their evaluations, as seen in this graph. The aid gap refers to the wait time and how women wait to receive help. To start, there are numerous instances where women wait longer than men in emergency rooms to receive medical help. This is a reflection of gender bias in healthcare. This graph shows how women wait a significant amount more time than men to get an electrocardiogram, and the study states how this factor contributes to system delay, ultimately influencing the quality of diagnosis the patient receives. Table 2 demonstrates how women also wait to receive medical help. 38% of women compared to 50% of men called 911 first, and 81% of women compared to 61% of men hesitated before going to the hospital. The study also states how these longer delays to get to a hospital are a product of the knowledge gap in women. Some women don't realize that they are experiencing symptoms of cardiovascular disease or are hesitant for other reasons. So how do we combat misdiagnosis in women's healthcare? These solutions are long-term, of course, but will have meaningful impacts if followed. Firstly, there needs to be more representation of women in clinical research and trials. Doctors, physicians, and women must be educated on sex-specific symptoms of CBT as well. There also needs to be more advocacy for this issue because if it's not talked about enough, then people are unaware and are not as willing to fight for it. And lastly, for women themselves who feel that their doctor or physician is not giving them adequate time or answers, they should always ask for a second opinion or a referral to a specialist. The key takeaway I would like the audience to have from this presentation is that there needs to be more awareness of cardiovascular disease misdiagnosis in women, especially since it's the leading cause of death for women globally. As heart federations across the world advocate for continued treatment, and if steps to combat this inequity are taken, we can see a vast improvement in women's health and possibly a decrease in the number of deaths caused by cardiovascular disease. Here are my references. Thank you to the GHLC at Johns Hopkins for giving me an incredible opportunity to present on this topic. Thank you to the GHLC community for being such inspiring and motivated students and making this conference memorable. And thank you to my family for always supporting me. Here is my Gmail if you would like to reach out with any questions. And thank you so much for listening.